Good evening, ladies and gentlemen. My name is Manita Sundar. I'm the Program Manager for the Prostate Cancer Supportive Care Program. Thank you for attending our special series lecture. Before I introduce our special speaker, I just wanted to thank Tercera for providing refreshments for this evening's lecture. So on behalf of the PCSC program, we're excited to welcome back Dr. Prue Cormie. When I first started in this program back in 2014, Dr. Cormie was actually our first lecturer for our lecture series, so we're excited to have her back. For those of you who don't know Dr. Cormie, she's an associate professor at the Australian Catholic University in Melbourne, Australia, and she's an accredited exercise physiologist. Dr. Cormie also has appointments at the Peter MacCallum Cancer Centre and the Olivia Newton-John Cancer Wellness and Research Centre. Dr. Cormie is not only an inaugural chair of the Exercise and Cancer Group in Clinical Oncology Society of Australia, but also the inaugural chair of the Exercise and Sports Science Australia Cancer Group. Dr. Cormie is well known for her recent TED Talk and is the lead researcher for the Exercise Medicine Cancer Community Program for Cancer Survivors. Please help me welcome back Dr. Prue Cormie.
Thank you very much for the lovely warm welcome. Sorry for the hugely long bio there. It's an absolute pleasure to be here tonight and have an opportunity to talk to you guys about exercise, specifically for prostate cancer. So what I wanted to start with, though, is talking about exercise not as something that's having a little bit of a potter around the garden, but rather about exercise as a medicine. So, I wanted to start by saying actually that we now know from quite a large body of scientific research that exercise is a potent medicine, and a medicine that we can use to help manage all sorts of different kinds of diseases. Now, what we know from a whole bunch of research that's done over many, many years is that exercise actually impacts the structure and the function of virtually all our body systems simultaneously. And there's really no other medication or therapy that can positively influence as many body systems as exercise can. Now, as exercise physiologists, we train in trying to understand exactly what happens to our body and inside our body when we exercise. And by having that understanding and that knowledge, we can really prescribe exercise just like any doctor prescribes any kind of medication. So we take specific types of exercise and we prescribe them at certain intensities. That's how hard it is. And at volumes, meaning how much of it is, based on what we call a mechanism of action, some sort of change that we want to happen inside of our bodies. And we want to target that as kind of a health benefit that we want to actually elicit. And in the same way that you have, 2 pills of a certain medication to give you a kind of dosage, we try and get the dosage right with the exercise so that we can make sure that that prescription of exercise is tailored to you and it's going to deliver the health benefits that we actually want to get out of the exercise. So we can prescribe exercise. It can be targeted and tailored to very specific health benefits. And we can then individualise that so that exercise can be different for every single person. Now, exercise is one word, but it's many, many different kinds of medicines. So that's what I'm talking about tonight when I say exercise. So let's start first by thinking about what is the scientific evidence around the impact of exercise for the management of prostate cancer. What do we know from the science about how exercise can help manage the disease? Let's start first with probably some of the most provocative findings that we have at the moment. And we see that, I think this is probably a really important question. If I exercise after I've been diagnosed with prostate cancer, what does that actually mean on how much that prostate cancer will spread throughout my body? And what we see from large observational trials, meaning that we take a bunch of guys and we just watch them over many, many years, and we see that the guys who exercise more after their diagnosis of prostate cancer actually have a lower relative risk of dying from their cancer. And they have a lower relative risk of that prostate cancer coming back. Now we know for anybody, regardless if you have prostate cancer or not, that if you exercise, you actually have a lower relative risk of dying from any cause. And this stands up when we see, when we look at guys with prostate cancer. So this data isn't our strong clinical trial evidence. It's only an observational trial. So we're not exactly certain what drives that or what the mechanisms are, why that happens. It could just be that the blokes that can exercise more, I shouldn't use Australian vernacular, sorry, the guys that should exercise more, maybe they just don't have as many symptoms because the disease isn't advanced, and that's why they're having a longer survival. And in saying that though, these are really rigorously designed scientific investigations, and we think that exercise is having some sort of change within our bodies to actually slow the spread of cancer cells throughout the body. Now, when we supplement this with actually looking about what happens to the poor old mice that get prostate cancer with an injection, these poor mice, and we put them on running wheels not we do, but a lot of scientists will do this, put these mice that have prostate cancer on running wheels, and they see what happens to them. And the mice that are actually exercising versus mice who don't exercise, the ones that are exercising actually have a slower spread of that prostate cancer. They have smaller tumours and they're not spread throughout their body as much as the mice that aren't exercising. And what's really interesting about this is that the mice that run a lot actually have even slower growth of those tumour cells and smaller amount of tumour and not as much spread throughout their body. So we call that a dose-response relationship, meaning the more exercise those mice did, the slower that cancer cells spread. So when you couple that observational data that we're seeing with what's happening on the mice, we don't really understand why it's happening, but we know that something's going on within our physiology. What we do know a lot more about, though, is how we can use exercise to alleviate and prevent the side effects caused by prostate cancer and its treatment. And this comes from our gold standard clinical trial evidence. So we know that this is really robustly designed science. And what we see with these robustly designed scientific investigations is that people who exercise actually have less physical functional declines when they're going through their prostate cancer treatment. Now, this isn't rocket science. We're certainly not going to win the Nobel Prize saying that if you exercise, you get fitter and stronger. But what this actually tells us is that even though the guys that are going through pretty aggressive treatments, and those treatments are kind of stripping away fitness, they're stripping away your strength, and they're making it really harder to do everything that you would normally do, we know that we can still exercise, and that exercise can be, you can do enough exercise and tolerate enough exercise to overcome those negative effects, and not just overcome them, but you can actually improve. And this is really important finding. So we can deliver exercise at a dosage that elicits an adaptation within our body, and that adaptation translates over into the ability to do functional things a lot easier. Maybe it's hitting a golf ball a lot further down the fairway, or maybe it's just getting in and out and around the garden a little bit easier. What we know from a lot of research as well is that exercise is the best medicine to help manage fatigue. It's kind of a really weird thing to think about, right? Because when you're fatigued, it's the last thing that you want to do. You want to rest. You don't want to be up and be active. But we know that exercise is better than pharmaceuticals, and we know that exercise is better than, or drugs, I should say. And we know that exercise is better than psychological interventions to help manage fatigue. So even though you're feeling really tired, we can still deliver exercise in a way that allows you to actually feel more energised. And that's both during and after the treatments. We know that exercise is the first step in helping to manage mental well-being or mental illness. And the blokes that exercise actually have lower levels of the severity of depression and anxiety. And they have lower incident or rates of getting anxiety and having depressive episodes. And we know that these guys experience less stress and have better mood. We also know that exercise can help counteract the negative effects caused by androgen deprivation therapy, help preserve muscle mass, so slow that kind of loss of muscle mass associated with the hormone therapy. It can help, certainly when it's supplemented with some nutritional advice, it can actually help to not gain as much fat mass, and then enhance the body image and your overall body composition. Now this is not just about feeling good about yourself, it's also about your health. So when you're going through androgen deprivation therapy, you can have a very quick increase in the amount of fat mass that you have, and sometimes that fat's around that trunk area, and that means that you're at a higher risk for actually developing other comorbid conditions, so chronic conditions like heart disease and diabetes. I think really interestingly, we're seeing that exercise may play a role in helping protect the heart against the negative side effects of prostate cancer treatments. So some scary stats actually when it comes to seeing what happens to the heart when you're on androgen deprivation therapy. So it's actually the time that it takes to develop heart disease, if you're on ADT, happens 5 to 10 times quicker. So this can be a big issue, and we certainly can use exercise as a way to try and minimise this, and we theorise that we can use exercise to make sure that the heart stays in a good shape and it pumps well and the function is very good. Now I could probably talk all night about benefit after benefit after benefit, but let me summarise it a little bit around all the other things that exercise may play a role in helping. So we know after surgery that people who do their pelvic floor exercises actually have better recovery of their continence. We know that guys going through androgen deprivation therapy, if they're exercising, they actually can have less sexual dysfunction, so they can increase libido. Pretty exciting thought, isn't it? A little bit of exercise. Can help slow the loss of bone mineral density. I think really interesting data that actually show that people who exercise, the doubling time or the rate that PSA increases is actually extended, so it slows that PSA doubling time. Sleep quality might be something that's really interesting and important. I think a lot of people struggle with sleep issues, and especially if you've got concerns around fatigue, that becomes quite an important outcome as well. And then I think really interestingly some theories and very early feedback from the guys around the potential of exercise to potentially slow cognitive decline. So maybe some changes that might be happening in your thinking or your memory. So exercise may play a role in actually helping preserve your brain function and allow you to think clearly, speak well, remember things, multitask, stuff like that. I think it's not surprising then if we show you all this data that exercise actually shows, the research shows that exercise improves quality of life. And we know that the quality of that exercise actually influences how much of an improvement you get. So the better quality exercise you do, the more improvement you're actually feeling in your physical well-being, your mental well-being, and your social well-being. I thought I'd really quickly whip through. We talk a lot about prostate cancer, but we don't talk a lot about other chronic diseases that happen. And a lot of the time, many of the guys that come in and see us, they don't come in with just prostate cancer. There's a lot of other chronic diseases that pop up. So what do we know from the research literature around how exercise can help manage these other diseases? First of all, let's talk about the heart. There's a lot of fancy words on there, but basically what this says is that people who exercise have a lower risk of developing heart disease. The blood vessels actually stay wider and clearer, and there's a lower relative risk of dying from cardiovascular disease if you are exercising. So exercise is very good for heart health. If you have diabetes, exercise is the first line therapy. It's the best thing that you can do to start out to manage your diabetes. And that's because it improves the insulin sensitivity, the thing that causes a lot of the issue with diabetes. We know that if you don't have diabetes, if you exercise, you actually have a lower relative risk of developing diabetes. So it's a nice way to help minimise the risk of developing diabetes as well. What about our bones? For you guys that are on androgen deprivation therapy, your bones are actually getting degraded a lot quicker than someone who's not on androgen deprivation therapy, so bone health is really important. We know from a lot of research literature outside of the prostate cancer space that people who exercise and do weight-bearing activities actually have a significantly lower risk of having a hip fracture. The amount of bone that's lost every single year is lower, much better balance, and reduced risk of falls. Arthritis is something that I think we don't talk about a lot, but it can be a really big issue. And it can be very problematic when we're thinking about exercise, and a key reason why you may not want to exercise or might find it difficult to exercise. Now, even though it seems, again, pretty counterintuitive that if you have pain and we're asking you to move, that's probably the last thing that you want to do. But what we see is that if you can move, and if you move in the right ways, exercise can actually alleviate some of that pain. And not only does it alleviate that pain, but it helps you maintain your mobility and be less impaired by that pain. It allows you to move around a lot better. As I mentioned before, it really helps when we think about mental well-being as well. So if you exercise, you have a 30% lower relative risk of developing depression. Having an improved mood state just means that you feel better. You have a lot of kind of improvements in the side effects that are associated with antidepressants. So you feel less lethargic, you actually have more energy. It helps with the weight gain that's associated with antidepressants, and we know that it actually helps reduce the risk of having depression flare up. I think a really interesting discussion, and something that probably doesn't get conveyed in the actual media, is that this relationship between fitness and fatness. So fitness is actually different, and how fit you are is different to how much you weigh. And these two things have very different effects on your health. This data here, what this shows is this actually says that if you take a man who is obese but is physically fit, they have half the risk of dying than someone who's skinny but unfit. Half the risk of dying. So there's what we call independent effects. So exercise, it doesn't matter how much you weigh. If you're fit, then you're doing something that's really good for your health. So I just talked a lot about all the good things that exercise can do, but what about the bad things? Surely there's bad things. Surely I can give you an excuse to not exercise, right? No, you have to exercise. But what we know from all this research is that exercise is safe. Exercise is safe when, it's a big caveat here, when it's appropriately prescribed and appropriately monitored. So all this information comes out of research trials where we have very highly supervised settings that we screen you guys all really well, and we make sure that we're monitoring your health and making sure that nothing nasty is happening. That's very different if you decide to go out and do boot camp in the park with a bunch of 20-year-olds. So probably not safe in that setting, definitely safe when you're seeing the right kind of professional. But what are the side effects? Well, you'll sweat, you'll puff, you'll feel a bit tired. May flare up some old injuries if you're not doing it right or you do it too quickly. So you've got to be careful of your back, your hips, your knees and so on. But again, if you have any of those issues, you see a health professional, they can help you work through that. And the severity of those side effects are really quite mild. The risk of actually having a heart attack or a serious heart attack is very, very low. So it's 0.8 times does it happen in every 10,000 maximal strength tests. So you don't go out every day and do a maximal cardiac stress test. You don't exercise to exhaustion every single day, and that's the kind of rates that we see. So it's very, very safe when you're talking about delivering it in the right way. So what are the recommendations then? Hopefully I've convinced you that exercise is a good thing to do. And from the research literature, it certainly shows that it's something that will be very beneficial for your health and well-being. But what do you need to do to actually realise these benefits? Well, first of all, if we could encapsulate the effects of exercise into a pill, it is undoubtable that every single one of you guys in here would be taking it. You'd be demanding it from your doctors, they'd be prescribing it to you, the government would be subsidising it. You'd probably be viewed as unethical and negligent if you weren't prescribed this medication. That's the value of what we see with exercise medicine. Now, unfortunately, that will, as I said, that will never happen because we can't just take exercise, you have to do exercise. And the reason that there'll never be an exercise pill is because, as I said before, that exercise really works to improve the structure and function of all of your body systems all at the same time. So it's a very efficient way to actually get healthy. So there's a lot of stuff that we don't yet know around exercise being a medicine. But there's something that we do know quite clearly from the research literature, from the science. And that is if we had this pill and you weren't prescribed it, it would be harmful. It would be harmful. You would experience more fatigue, more functional decline, higher rates of mental issues, and you'd have poorer quality of life. So based on what the science tells us, exercise is probably the best medicine you can take in addition to your standard cancer therapies. And that's because exercise reduces the severity and the number of treatment-related side effects that you'll experience. Now, in saying that, the science is telling us that exercise should be viewed as a standard component of prostate cancer care. And when you're going for your surgery and you prescribe your androgen deprivation therapy and you prescribe your radiation therapy, you should be prescribed exercise right alongside that. And it's not just me standing up here saying this as the tragic exercise person. This is now the position of the peak professional body in Australia, which is called the Clinical Oncology Society of Australia. So this is where all the doctors and the nurses come together and they kind of steer the direction of where oncology is going in Australia. And what we've actually said through this statement is we've said that exercise should be viewed as an adjunct therapy and prescribed as a standard component of cancer care to all guys with prostate cancer, to all people with cancer. So the doctor's responsibility is to discuss exercise with you, to recommend that you adhere to the evidence-based guidelines, and then to help you actually fill that prescription to refer on to an exercise physiologist or a physiotherapist who has the skills and the capacity to show you how to do that and to help you fill that prescription. So if we did have an exercise pill, if we did prescribe it, what would that prescription look like? What do you have to do? First of all, it starts with avoiding activity. So even if you're going through really difficult treatments or you're not feeling well, try just to be as active as you can, as active as your current conditions will allow you to be. That's a great first step. Really important to remember that some exercise is better than none, and generally speaking, more is better than less. What do you have to do if you want to have these significant health benefits that I talked about in the research? You need to be working towards, and once you achieve these levels, maintain participation in 150 minutes of moderate intensity aerobic exercise each week and 2 to 3 resistance exercise sessions. And that probably looks like a lot of gobbledygook. What does it actually mean? So 150 minutes is a 30-minute brisk walk on 5 days a week. So what do I mean by a brisk walk? What's moderate intensity? So moderate intensity isn't walking along the street with your chihuahua, having a chat to Betty next to you. It's being pulled down the street by your German Shepherd. It's walking like you're running late for a really important appointment. You need to be puffing. Your heart needs to be beating. You probably will be sweating a bit. In addition to this, and what we so often miss when we're thinking about all the messages that are out there in the media, is that we need to be doing resistance exercise. You guys especially. All the research that we've seen these beneficial effects, they all involve resistance exercise. That is lifting weights. So what is 2 to 3 moderate intensity resistance exercise sessions? What does that mean? It really means, in an ideal situation, going to the gym 2 or 3 times a week for 30 minutes, 45 minutes, working about 6 to 8 exercises involving the big muscle groups. And again, you need to be working hard. So sweating, puffing, heart's beating pretty hard. You need to be lifting weights that you can probably manage to lift 8, 10 times, maybe 12, but not much more than that. So you've got to be working hard to generate a physiological response. Now, if you look at this, these are actually, the recommendations for you guys and all other cancer patients are actually the exact same as it is for me standing up here without cancer. So for a lot of people, these targets are completely out of reach. And there's no way in the world that one size fits all when it comes to exercise. So for some of the people that we work with, we pretty much rip these targets up and we start where we start and then we just progress. We just chip away. Maybe one day it's just a 10-minute walk and it's a 10-minute walk with your child. And then maybe we try and just extend that out to a 15-minute walk and so on. So the key thing with this is that the exercise prescription needs to be individually tailored and individually progressed. When we think about this intensity as well, we're not talking about you going out there and running marathons or turning into Arnold Schwarzenegger. Intensity is actually what we call, it's relative, right? So it may change. You're not going to be able to, what's moderate intensity for you when you're 18 is probably going to be way in excess of extreme intensity right now for you. So, we're not talking about lifting a lot of weight or walking a long way or things like that. So this is achievable if you know exactly how to do it and you're seeing the right people to help you do that. So if you are seeing that health professional, how do we individually tailor that prescription? What things do we think about when we're actually talking to you around what exercise to do and how to do that? Well, first of all, it starts with what's important to you. So why do you want to exercise? What benefits do you want to actually feel from this? Do you want to be able to continue to walk around with golf? Or do you want to be able to continue to run around with your grandkids? Whatever it may be. Maybe it's to go and do a 5K fun run or something like that. Whatever it is, we can tailor it to that. And then we think about a whole bunch of stuff about what's going on with your actual health. So what stage of disease have you been diagnosed with? What treatments have you gone through? Are you experiencing any side effects? How severe are those side effects? Does anything trigger an exacerbation in those side effects? How functionally capable are you? Do you have any old injuries that we need to think about? What's going on with your heart? Do you have another chronic condition that we need to think about? And then what are the kind of practical considerations that we need to take into mind? Are you working? Are you looking after family members? How much time do you have, and so on? And if you see the right person, they'll actually tailor the exercise prescription specifically to you. So who is that person? Who is the person that can prescribe you an individualised exercise prescription? Well, it's a clinical exercise physiologist. Now, these are university qualified allied health professionals who specialise in using exercise as a medicine for people who have chronic diseases. Now, I don't know exactly how many there are in Canada, but there are around, and you guys are very lucky to have Sarah Weller here. So if you haven't seen her already, make sure you go and see her. You definitely want to, if you're not from around here, you want to try and see someone who's got some experience and knows a little bit about prostate cancer. And we can try and train people up if you have anyone who you want to work with, and you can let them know about a course that we have. So if you say, okay, I know exactly how much exercise I have to do, I know what the prescription is, I know who I need to see to help me fill that prescription, but could I actually do that? Can I fill this prescription? And I think when you think about how much exercise that is, a lot of the time you probably think, oh, there's no way in the world I could do that. Well, we see a lot of blokes that think that, and we actually get them to fill that prescription. And they can do it 80 to 90% of the time. And that's participating in 3 days a week of exercise. And that's over a 3 to 6 month period. So people can and do this even though they're going through difficult treatments. So another question is, am I actually going to get a benefit out of this medicine? If I pop this pill, so to say, will I get a response? Well, the sad fact is that sometimes people just don't get any better or get any fitter when they exercise. So there's what we call responders and non-responders. That's a really sad thing if you're a non-responder. It's kind of crushing a little bit, but it is out there. We don't really understand why or how that happens, but I tell you what we do know is that people who actually don't have much experience with exercise, people who aren't very fit, who may be experiencing a lot of symptoms and side effects, they're the ones that benefit the most from exercise. So even if you think that you are least likely to be an exerciser, never before exercised in your life, you're probably most likely to benefit out of the exercise. So how is the kind of best way to take this medicine? To take 2 tablets with breakfast, what does that look like in exercise? Well, first of all, it starts with seeing the right specialist who's going to help you get the exercise that's right for you and teach you how to do that. So if you have it supervised, if you're supervised by the appropriate health professional, clinical exercise physiologist, that's a really important first step. Then it's about thinking about where you can go to exercise. The weather is probably a really big barrier to exercise here in Vancouver, so finding a convenient location, one that you don't have to go a long way for, one that's not going to take you 20 minutes to find a park or make you remortgage your house to pay for parking. The other thing that can help is being around a bunch of other guys that are going through a similar experience and trying to exercise together. We certainly deliver our exercise programs in that way, and a lot of the guys are really surprised around how they actually benefit from the camaraderie and that group-based environment. And it's not necessarily to say you need to go there and engage with with the guys in a big way. It's just knowing that you can if you want to. More importantly, what's kind of the best approach for you? It's really what's going to work for you, and that's it. And if you see the right health professional, they can figure that out with you together. Doesn't matter if it's in the gym, if it's at home, if you're doing it by yourself with a friend, if you're walking, if you're running, if you're swimming, whatever it is, it's whatever's going to work for you, whatever's going to get you off the couch and get you exercising. So why should you exercise? You should exercise because what the research tells us is that it may actually help slow the progression of your cancer. It'll help you tolerate the treatments that you're going through. You'll experience fewer side effects, less cancer-related fatigue, less psychological distress. You'll feel fitter, stronger. It is safe, and you'll feel like you have your quality of life is coming back again. Thanks very much. Happy to answer any questions.